Good afternoon, everyone. My name is Erica Harquist. I'm a Public Information Officer at the Health Information Center for the COVID-19 response. I'd like to welcome Oregon State Public Health Officer and epidemiologist, Dr. Dean Seidlinger. Here are some reminders before we start. This is a call for our media partners. So the public is more than welcome to listen in, but we have reserved this time for the media, and we offer the public space during our Facebook Live events. So please sign in with your name and the media outlet you are representing. If you'd like to ask a question, send an instant message there to the OHA host. And for our broadcast friends, if you need permission to record, send a chat message now to the OHA host, and we'll wait a little bit here while you all get rolling to give you some time to get going. Okay, great. Well, thank you so much, everyone, again for joining us. And now I'll pass it over to Dr. Seidlinger.
Thank you, Erica. Thank you and good afternoon. I'm Dr. Dean Seidlinger, the health officer and state epidemiologist here in Oregon. The Oregon Health Authority today released updated guidance about mask and physical distancing requirements for individuals fully vaccinated against COVID-19. Under the updated guidance, people who are fully vaccinated will no longer be required to wear a mask indoors in most public settings where vaccination status is checked. In indoor public settings where vaccination status is not checked, masks will still be required. Businesses and venue operators remain free to establish their own more restrictive policies regarding mask usage. In addition to exempting people who are fully vaccinated from mask requirements in most indoor settings, mask requirements no longer apply to anyone who is outdoors. However, OHA recommends that individuals continue to wear a mask or face covering in crowded areas and large gatherings, such as sporting events, and to maintain physical distance as much as possible. OHA urges unvaccinated individuals and those at risk for complications to wear masks in these settings. The new guidance comes after the CDC last week announced that individuals who are fully vaccinated against COVID-19 could stop wearing masks and stop physical distancing in most public spaces. This is great news. We have effective and safe vaccines, and cases are decreasing. As Oregonians, we must continue to fight the virus, and getting vaccinated is one of our most powerful tools. While Oregon's COVID cases are decreasing as a state, we currently have one of the highest rates of COVID-19 in the country. While the number of individuals with COVID in the hospital has stopped climbing, there are still about 340 of our neighbors in the hospital with COVID today. This is too many. For those who are vaccinated, thank you for taking the steps to protect yourself and those around you. For those eligible who aren't yet vaccinated, make a plan. Talk to your healthcare provider if you have questions. Only together can we continue to drive down COVID in Oregon. I'm now happy to answer questions at this time. Thank you.
Great, thank you so much. All right, let's take a look at our question queue here. Our first question is from Connor McCarthy with KZTV. Connor, go ahead.
Hi there. So I was just wondering, why are there still some restrictions to indoor public settings where vaccination history is not checked? I know the CDC said pretty broadly that masks aren't required indoors. Why is Oregon taking this step to still require masks in these types of settings? And what are some examples of one of these settings?
Thank you, Connor. The CDC requirements that were laid out last week did mention certain settings where masks are still recommended by the CDC. This includes healthcare settings, correctional settings, homeless shelters, and K-12 schools. So these are settings that this new guidance does not apply to. In addition, the CDC guidance said that individuals and businesses should follow the rules and regulations in the states and localities where they are. And so in Oregon, the decision was made to give individuals a choice. As I said in my opening remarks, Oregon has one of the highest case rates currently in the country, and we have not yet achieved even half of our population fully vaccinated. We know that vaccine efforts have not been equal across our state, with some communities having higher vaccination rates than other communities. Some of our most impacted communities, our African American community and Latinx community, have not yet been vaccinated at the rate of white Oregonians. So by implementing this plan with a choice for individuals to continue to wear their masks in these indoor settings if they feel more comfortable or choose not to share their vaccine record, and offering businesses the opportunity to continue to operate under the guidance that has existed in Oregon for much of the last year, requiring masks and physical distancing in these indoor settings that are at higher risk for transmission than outdoor settings, businesses can choose to do that. If they'd like to offer the opportunity to serve clients or have their staff not wear masks and not keep physical distancing, they need to have a system in place to check vaccination status to assure that individuals are fully vaccinated so they're not putting others at risk in that setting.
Thank you, Connor. Okay, our next question comes from Jamie Goldberg with the Oregonian. Go ahead, Jamie.
Hi, yeah, I wonder what other states, if any, did OHA look to in implementing the guidance that would require businesses to verify vaccine status, whether there are any other states that have similar guidance in place. And then secondly, I know not everyone necessarily kept their vaccine cards. What are fully vaccinated individuals supposed to do if they no longer access their vaccine card?
Thank you, Jamie. Well, I don't know the rules in every other state, but I do know that several states and cities and other local governments have chosen not to implement the new CDC recommendations at this time and continue to require masks and some level of physical distancing across all indoor spaces. In Oregon, we wanted to recognize the significant protection that vaccination offers to the individual and to those around them. They do not put those around them at risk for getting COVID-19. So we wanted individuals to be able to go out without their masks and physical distancing and feel safe about that they're not putting themselves or those around them at risk. We also know that for many businesses they want to be able to offer services to their clients, to their customers. They want to be able to have their staff be at work without masks. So if they have a process to review vaccination records and show that people are fully vaccinated, they're free to serve customers in that manner. If they don't want to or cannot implement a system like that, they can continue to operate under the OHA guidance that requires masks and physical distancing in most indoor public settings. And these two options will remain for individuals and businesses for the coming time as we work to continue to increase vaccination rates and to drive down cases. As for vaccination records, many people have their card or have a printout from their provider or wherever they got their vaccine. A vaccine record, as it's spelled out in the guidance, must include the individual's name and birth date, the vaccine that they received, including the date that they received their 1 dose of Johnson & Johnson or 2 doses of Pfizer or Moderna, and the location where they got their vaccine. This vaccine can be a paper record, can be a copy of a paper record, or a photograph on your phone or another device that shows that record. This record will not be recorded by the business, just needs to be reviewed so they can show that you're vaccinated and can enter that business without a mask and without physical distancing, without putting the staff or other customers at risk from obtaining COVID. Again, COVID vaccination is safe and effective and our best tool for continuing to drive down rates of COVID in Oregon, which remain far too high, with one of the highest case rates. But Oregonians are doing a great job. We see Oregonians 12 and up rolling up their sleeves and getting their vaccines. And we encourage you to talk to your provider if you have questions and make a plan to get vaccinated if you're not yet vaccinated.
Thank you for the question, Jamie. Okay, next up is Rachel McDonald with KLCC. Rachel, go ahead.
Hi, thank you. this kind of is along the same lines as the previous question, just how are businesses supposed to check vaccination status? And it seems like businesses have already had a rather large burden of having to ask people to be masked. And now it seems like it's adding an additional burden on small businesses, especially when they have to then be checking people's vaccine cards, and those can be faked. They're kind of, I'm just wondering about the pressure that this adds to our local businesses.
Thank you for that question, Rachel. I think that's why we want to be very clear that businesses have a choice to continue operating under the guidance that's been in place here in Oregon, or to adapt this new guidance to their place of business. For businesses that think this is too much of an administrative burden, or they don't want to be responsible for checking vaccination records, they don't have to review those records. They can continue to serve their customers, to have their employees wear masks in these settings. For a business that wants to choose to serve their customers in a different way, by allowing them to remove their mask if they're fully vaccinated, or have their staff be able to remove their mask if they're fully vaccinated, they need to institute a system where individuals can share their vaccination status, show their card, which can be reviewed so that they can be served without a mask or physical distancing. Again, businesses have choices and individuals have choices on how to protect themselves and those around them.
Thank you, Rachel. Next question comes from Brenna Kelly with KPTV. Go ahead, Brenna.
Yes, thank you for taking my question. Will there be enforcement from an agency other than the business, like OHA? And if so, who's going to carry that out if it's not OHA? Will this have any impact too on the existing county risk level framework, especially in terms of capacity? And do you see this verification burden on businesses ever going away? For example, when the state reaches 70% people vaccinated?
Thank you, Brenna. Let me take the first part of that question. The enforcement of these guidance, like our previous guidance during this pandemic, is enforceable. We have our partners at Oregon OHA, Oregon Liquor Control Commission, and our local public health authorities have been enforcing different parts of this policy. There are methods in place for an individual to make a complaint, as our enforcement policy is complaint driven. And we will attempt to get to those complaints, to follow up with businesses, provide them education on how they can follow the guidance, and provide a safe environment for their employees and the customers that they serve. I don't anticipate that this sort of system will be in place forever. As Governor Brown announced last week, we have some goals in place for how we ease restrictions. Counties right now, if they meet 65% or more of their population 16 and older, and have an approved plan, equity plan, to close the gap between their white residents and those communities of color, they can move to lower risk immediately. And we anticipate an announcement from the governor later today about that first round of counties that may be eligible. As a state, if we reach a goal of 70% of adults having received at least one dose of vaccine, the current county risk level framework will go away, with some systems in place to help control the spread of this disease. This might look different across different settings, like schools and others, but most of the rules that we've been following all year, the capacity limits that businesses have been dealing with, and the other regulations and guidance that have been in place, and we would anticipate going away when the state reaches that level. By reaching that level, that means that almost 3/4 of adults will have some level of protection against COVID-19 disease from this very effective vaccine. We also anticipate that as our cases decline, which they are doing week over week, and that our models predict will continue, will be at a much lower rate, that individuals won't be at higher risk for contracting the disease when they're out enjoying the Oregon summer. The Oregon summer weather and being able to be outside hiking, having picnics, going to the beach and going to the mountains also is a great tool for us to reduce the spread, because this disease spreads much less easily outside. And so we can enjoy a summer much more like 2019 than like 2020.
And just a follow up, if I may, in other words, you're saying businesses cannot resume full capacity at this point if they choose to adopt this verification of vaccine cards?
The current guidance on what fully vaccinated individuals can do in public and how businesses can serve them does not affect the capacity limits. The process that the governor announced last week for counties to be able to move to a lower risk category when they reach 65% or more of their 16 and over population vaccinated and have filed an equity plan will allow businesses in that county to serve more individuals with higher capacity limits. And when, as a state, we have 70% or more of individuals who've received one or more doses of vaccine, we will all be able to move into a system where those capacity limits have gone away and will be maintained with some common sense regulations and guidance that will help us protect ourselves, particularly those most vulnerable, individuals who are immunocompromised, and children under 12 who right now are not eligible to get vaccines. And while we're happy that most of them do not get seriously ill, some of them do, and they can still pass the disease on to others, even though they're much less likely to.
Thank you.
Good questions. Thank you, Brenna. Our next question comes from Rachel Monahan with Willamette Week. Rachel, go ahead.
I guess I have two questions. One has been mentioned sort of previously about the authenticity of vaccine cards. They're easily faked. They're not actually considered a medical record. I'm wondering if the state is considering at all whether that's a problem. And my other question is the broader issue of allowing people to take off their masks. Like, part of the argument for this from a public health perspective has been that it provides an incentive for people to get vaccinated. But is that actually, do you think that's actually impacting Oregonians' desire to get vaccines? Are you hearing or have any evidence that that is moving people towards getting vaccinated?
Thank you, Rachel. I'll take the first part of your question first. We're not expecting businesses or others who review a vaccine record to check for its authenticity. We hope that Oregonians will not lie or cheat and put others at risk by forging a vaccine record if they're not vaccinated. Those individuals can choose to get vaccinated, or if they choose not to or don't want to share the fact that they're already vaccinated, they can wear a mask and keep their distance and be served by that business. Individuals have options, as do businesses, in implementing this system. As for allowing masks off and being an incentive, we've heard from many people who've been waiting to be able to remove their masks in multiple settings once they're fully vaccinated. This vaccine is highly effective, and that protection lasts for months, as we've seen from the studies following up Pfizer, which we've been using the longest, as well as Moderna. So to have 3 safe and effective vaccines just over 1 year into this pandemic is an amazing tool that we have. And because of that high level of protection, individuals can now go out without their mask and without physical distancing in most settings. They can have a gathering with their friends and family and loved ones. They can patronize a business and remove their mask if the business has a system in place to review vaccination records. And all Oregonians can gather together safely outside without their masks and physical distancing. We ask that some individuals who are unvaccinated or at higher risk for COVID, who may be immunocompromised, or those who are on children younger than 12, consider their plans and consider whether or not they're putting others at risk. But an individual who's fully vaccinated is very unlikely to get the disease themselves and is even more unlikely to spread the disease to others. So that's why we've updated this guidance, and we think it will be an incentive for some to get vaccinated. For others, they may want more information. We urge them to go to the OHA website, the CDC website, or to talk to their healthcare provider and to get more information about the vaccine.
Thank you, Rachel. Our next question is from K2, Kelly Azar. Go ahead, Kelly.
Hello, thank you for taking the time today. We have spoken with a couple of businesses who say that they have received threats if they are going to be asking for any sort of verification or requiring verification of their vaccine to be able to go maskless. Now, one of the ones in particular, is the Enchanted Forest. So what would you say, it's now to the point that they're even delaying reopening, a business that was already hit extremely hard. what do you say to folks out there who are confused by the mask guidance, being that the CDC says it is okay to be out mask free if you have a vaccination, but now you're also saying businesses can require proof?
Thank you for that. I will say all of us as individuals, as businesses across Oregon have been hard hit by this pandemic. Whether we've been physically ill because we were infected with COVID, the mental health challenges that have come from changing the way we work, from losing a job, from providing in-home school for our children who could not attend school for much of the last year, and multiple other problems. So this has been a tremendously hard year for everyone from COVID. And this is one step towards moving towards normalcy and moving towards recovery. For businesses, that have received threats about if they require, reviewing vaccination records when they come in, they have an option to continue the current system to serve their customers and to have their employees continue to wear their masks, keep their distance, and follow the rules. The CDC guidance was about individuals. The individuals who are fully vaccinated 2 weeks out from their last vaccine are not at risk from going out in public without a mask and physical distancing. They're not putting others around them at risk. And the CDC guidance deferred to local and state rules or business rules that were more strict, and that individuals should follow those rules. In Oregon, with one of the highest case rates currently in the country, and less than half of our population vaccinated, we know there are a significant number of people who are not protected against this disease and are vulnerable if they're exposed to someone with COVID in one of these public settings. So we want to be sure that individuals who are in these settings who are fully vaccinated, that has been reviewed and that they can be served and aren't putting others at risk. We hope that individuals will continue to follow the rules because it's by working together and doing things to protect ourselves and our loved ones that we're going to get through this pandemic together. Overall, Oregon has some of the lowest case rates and case fatality rates of all states. But unfortunately, we're in a position now where COVID is still spreading fairly rapidly across the state. It is coming down, and this change in our guidance allows individuals to more safely go about Oregon, a little bit more sense of normalcy for those who are fully vaccinated without putting themselves or their community at risk, and this new guidance supports that.
Thank you, Dr. Seidlinger.
Thank you, Kelly. Our next question is from Amelia Templeton with OPB. Go ahead, Amelia.
Yes, hi, can you hear me?
Yes.
So hospitalizations remain well over the threshold the governor had said just a month ago indicated strain on the hospital system. Presumably anything like this that's going to change people's behavior will also have some effect on transmission. What is the state going to do going forward to preserve hospital capacity and to make sure that the healthcare system isn't overly burdened by patients?
Thank you for that question, Amelia. When we looked at the hospitalization metric that was added to the current county risk level framework, it had two components. We looked at the overall number of individuals who are in the hospital across the state, because we know individuals are often transferred in from more remote parts of the state for specialized care in Portland, and that individual regions will transfer patients between regions based on their hospital capacity. So we looked at, as a state, a number of 300 or more individuals in hospital beds at any one time. But we also looked at the rate of increase. And several weeks ago, we were seeing a 30% increase in hospital bed census week over week. So a relatively high number, over 300, with a steep increase, puts our hospital system at risk for not having the staff and beds available to care for those with COVID and those with other conditions, such as recovering from a heart attack or after a motor vehicle crash. Right now, our rates still do remain above 300, with just under 340 individuals in a hospital with COVID-19 right now, but the rates are not increasing week over week and actually have leveled off. This is likely reflective of the surge in cases we saw over the last almost 2 months. We anticipate that this will slowly start to come down. We monitor this data regularly, have conversations with our healthcare partners, and we'll come to you and tell you if we're seeing something worrisome that might mean that people need to take additional measures to protect themselves and those around them, and to protect the hospital capacity that we know needs to be there for everyone. Right now, we're not seeing that rate increase. We're seeing a level off of hospitalizations. We hope that that will continue to go down as more Oregonians get their vaccines and more Oregonians continue to follow the rules to protect themselves, loved ones, and broader communities. Because that's how we've gotten through this pandemic together with some of the lowest rates. But now we need to get through this surge, and we need to do that together.
Thank you, Amelia. Our next question is from Pat Doris at KGW. Go ahead, Pat.
Thank you. Dr. Seidlinger, this question about the vaccine passports and requiring proof at the door for businesses that want to lose masks brings up the question, why not just trust the public? If they're coming in without a mask, why not just trust that they're vaccinated?
Thank you, Pat. I think at this time we have to go back to what is the situation on the ground here in Oregon. We know that again, half of individuals are not fully vaccinated against COVID, and that we have a significant amount of disease spreading in the community. We want that business who chooses to operate under these new guidance to be able to have that sense of safety for their staff and the customers that they're serving, that they have a situation in place to review these records. Businesses that don't want to do that or can't implement a system like that can continue to operate under the current guidance. We know that there are still many Oregonians out there who have not been vaccinated. For some, it's a choice. For others, they've not been able to access a vaccine in a convenient way in their community. They have questions that have remained unanswered, and they would like answers to those questions. So for those employees and those customers who are in that setting, we feel that this system of asking about vaccination status and reviewing a record to determine if they're 2 weeks out and fully vaccinated offers a level of protection for individuals while the disease is still surging here in Oregon. Cases are coming down, not as quickly as we'd like, but week over week, we're seeing less Oregonians who are sick. And we hope that this will continue. That's what the modeling data shows, and that's what every vaccine into arms helps us accomplish.
Thank you, Pat. Also from KGW, our next question comes from Mike Benner. Go ahead, Mike.
Thanks, Erica, and thank you, Doctor. I will actually pass off the baton. Several questions have just been asked in the last 2 minutes.
Thanks, Mike.
Great. Our next question comes to us from Ben Botkin with the Lund Report. Hey, Ben, go ahead.
Yes, I was wondering if you could clarify, are businesses able to keep a list or record of customers that have shown a vaccination card so they don't have to do it repeatedly if they're a regular customer at, say, a restaurant or other business? Thanks.
Thanks, Ben. Our current guidance doesn't go into that level of detail. We just put in place a review of that record upon entry so that people could feel comfortable sharing that information with a business and knowing that it's not recorded. If an individual business chooses to use that information to store that information in another way, I think they would need to make that decision and inform customers of what they're doing. Again, we've tried to make this as convenient as possible, that individuals could have a card, a photocopy of a card, or even a picture on their cell phone, which almost everyone carries, and be able to show that individually. You know, for a business that regularly serves a customer and knows them and has verified their record, they don't need to continue to do that. For a business that knows that their staff members have been vaccinated because they've reviewed those records, they don't need to check that every time they come in. How they choose to keep track of that is an individual business decision.
Thanks, Ben. Our next question is from Kay with the Gazette-Times and Democrat Herald. Go ahead, Kay.
Hi, can you hear me?
Yeah.
Great. So the state's kind of taking this honor system approach with the vaccine cards. We've already seen instances of businesses and customers being non-compliant with COVID-19 protocols throughout the course of the pandemic. If you pair that with us having one of the highest new case rates in the country, less than 50% of our adults are fully vaccinated, how much of an increase does the state expect to see in cases, hospitalizations, and deaths And kind of a follow-up to that is why now? Why not wait until we see that vaccination rate climb even further?
Thank you, Kay. I think, again, as Dr. Walensky said in the announcement from the CDC last week, we have additional data now that shows these vaccines are safe and that individuals who are fully vaccinated are at extremely low risk from getting the disease themselves. And that even those individuals who may get sick after being fully vaccinated are very unlikely to pass that disease on to others. So from an individual standpoint, the CDC updated guidance to say individuals who are fully vaccinated can go out into these settings and not put themselves or those around them at any higher risk. But what we know, as you said, with about less than half of our population fully vaccinated and the high case rate, we know that there's still COVID in the community and that not everyone has had the chance to be vaccinated where they would like or to have their questions fully answered. That's evidenced by the disparity in vaccination rates amongst different communities. So by implementing this system where individuals can choose to continue to wear their mask even when they're fully vaccinated, can continue to patronize businesses when they're fully vaccinated and not show their card by wearing their mask and keeping their distance, and by offering a similar choice to businesses that they can review the records of those who are coming in to help assure that it is a safe environment, or they can continue to operate under the current system, will help protect individuals as we get through this current surge in cases, which again are declining week over the last 2 weeks. It will allow us to get more vaccines into arms over the coming weeks as these vaccines are available. It was heartening to see those 12 to 15 lining up for vaccines this weekend when they finally became available to them. Individuals should be very excited about this vaccine. I know people have questions and some people are hesitant, but we have information out there. Your healthcare provider is a great source, but these are incredibly safe and effective vaccines that will allow us to control the spread of COVID-19 even more than we have so far and allow us to get back to a more normal life where businesses aren't having the constraints on them, where individuals aren't thinking about COVID when they leave the house, that we go back to a way where we enjoy our families and friends, can mourn the losses we've had over the past year, rekindle those celebrations that we've had via Zoom that just aren't the same, and have that time together with our friends, families, and loved ones. And this is one step towards implementing that. In spite of our higher case rates, we will get through this. We're on the right trajectory in terms of vaccination and case rates. And those paths should continue based on all the modeling we have.
Thank you for that question. Our next question is from Heather Roberts with Central Oregon Daily News. Go ahead, Heather.
Thank you. Dr. Seidlinger, we know that these new guidance does not apply to K through 12 schools. So in schools, everyone will still be required to mask up. But it says that the guidance does apply to K through 12 sports. So does that mean athletes, if they're fully vaccinated, no longer need to wear masks? And if so, how are schools expected to keep track of that when they've been very reluctant to ask for vaccination status to begin with?
Thank you for that. As the CDC stated in their updated recommendations last week, there are certain settings where masks are still required. Healthcare settings, correctional facilities, homeless shelters are settings where masks would still be required, as well as transit, including airports and airplanes. They deferred to the CDC guidance on K-12 schools, which recommends masks as part of an overall layered approach to providing protection in schools. In Oregon, we're following that with our Ready School Safe Learners, offering those layers of protection outlined in the CDC guidance for those who are attending schools. And the CDC has indicated that they will not be changing their current school guidance, and that will remain in place for the remainder of this school year. We anticipate updated guidance from the CDC for the fall, and updated Ready School Safe Learners guidance here in Oregon to guide how school looks like in the fall. And we anticipate a lot more return to normalcy with case rates down, vaccination rates up, and even less of a risk of spread in school. For athletes and those who are fully vaccinated, again, outdoors, we updated our mask guidance to say that individuals who are outdoors do not need to wear a mask, except that we would recommend that individuals who are unvaccinated, especially if they're at high risk for disease, consider still wearing a mask when they're in crowded outdoor places. So for those athletes, K-12 or otherwise, who are playing sports outside, that guidance would apply. For individuals who are fully vaccinated, who are in an indoor setting and vaccine status could be reviewed and verified, they're allowed to play without a mask and without the physical distancing requirements. Again, that would follow the guidance for fully vaccinated individuals that we released earlier today and follow the updated guidance for outdoor mask use that we updated today.
Thank you for that question, Heather. Now we're on to follow-up questions. We have a second question again from Amelia Templeton with OPB. Go ahead, Amelia.
Yes. So the governor has announced this 70% vaccination target and said the economy would mostly reopen when that happened, but didn't clarify what that meant for masking. Will these new mask guidelines still be in place after we get to 70%, or could we expect a full lifting of the statewide mask mandate, except in, maybe some specialized settings?
Thank you, Amelia. The governor has stated that the current county risk level framework would go away. That would remove capacity limits on most businesses and locations, indoors and outdoors, allow individuals who are planning events to plan larger events that utilize the full capacity of those venues or locations where they're having them. The governor said that some guidance will still remain in place. So we will reevaluate our guidance as we get closer to that 70% goal, look at the CDC guidance and the evidence that's guiding that to see if masks will still be required in certain places or if they will be recommended for those individuals who are unvaccinated or at higher risk. Again, we need to see what our rates of disease are like at that time and see if we can lift as many requirements as safely as possible for individuals in those settings. But I would anticipate a significant change in our guidance as we reach that 70% goal, that individuals will see, be able to leave their house without thinking about COVID, likely without grabbing a mask in many situations, and that businesses will be operating in a fashion much more similar to pre-pandemic than they have been during the last year. This year, as I said, has been incredibly tough on all of us in multiple ways. Some of it from COVID itself, some from the measures we put in place to limit the spread of disease and keep Oregon a leader across the country with low case rates and low fatality rates. We need to get through these last few weeks together, and I know we can. We did it last spring, we did it last summer, and we did it very impressively this winter with peak in cases much lower than most other states. And that was done by Oregonians following the rules, looking out for themselves and their neighbors, and taking some common sense action to protect themselves. And vaccination is one more step in that process.
Thank you for that question. And our final question, and this is also a follow-up, again from Kay with Gazette Times, Democrat Herald. Go ahead.
Yeah, does the state expect cases, hospitalizations, and deaths to increase? If so, how much?
Thank you, Kay. I think you asked that before and maybe I didn't answer it, so I apologize. I think, with the guidance we wrote in place, we would not expect to see significantly increased transmission. Transmission of COVID-19 outdoors is much lower than it is in indoor settings. So that's why the mask guidance has been updated overall for outdoor settings. Again, with individuals who are at higher risk or have not yet gotten their vaccine, making individual choices about crowded situations, continuing to take those precautions for themselves. In indoor settings, and all settings really, for an individual who's fully vaccinated, they are not at risk from contracting COVID in those settings. They're also not at risk or not putting those around them at risk from getting COVID from them, even if they get sick, as they're likely to have a mild asymptomatic illness. So these guidance will allow us to maintain the safety that we have in place while we continue to see decreased cases. If people don't follow the rules and aren't vaccinated and aren't wearing masks in higher risk indoor settings, we could see an increase in transmission, and we could be back talking about constraints on our hospital capacity. We hope not to be there. Oregonians have followed the rules during this last year, have really come together as a community, as a state to fight COVID, and really are a national leader. We have saved thousands of Oregonians by the steps we've taken to protect ourselves. Our death rate could have been 2 or 3 times as high if we were anywhere near the national average, and we have not seen that. So while every death we've seen from COVID-19, every impact on people's physical health, mental health, and economic impact is hard. We can recover from those other pieces, but we can't bring our lost Oregonians back. So Oregonians should be proud of the actions we've taken. I hope we'll continue to take those actions to protect ourselves and those around us, and we will get through this current surge. Cases are coming down, hospitalizations are leveled off, and we have an amazing tool, revaccinations, that'll help us get through this and get through this stronger.
Thank you, everyone. And thank you so much, Dr. Seidlinger, for your time. Great, thoughtful questions from our media partners. And that'll do it for us today. Thank you. If you have any follow-up questions, feel free to email the media inbox. I know you have that email address, and we will be happy to answer them. Have a wonderful day, everyone. And thanks again.